Good afternoon, everyone, and welcome to the National Patient and Family Engagement Learning and Action Network Kidney Caregiver Peer Connection Call. My name is Melissa Perry. I'm a manager of patient and family engagement with the End-Stage Renal Disease National Coordinating Center. But before we get started, there are just a few things that we would like you to remember. All lines are muted. The operator will provide instructions on how to ask a question and unmute your line when it is your turn. This call is being recorded. The recording will be posted to the ESRD NCC website and promoted on social media. Please do not disclose any information you would not want made public, such as your date of birth or the name of the dialysis facility or transplant center associated with your loved one. Do not ask for medical advice. We have asked the panelists not to provide medical advice. The role of the panelists is to share their personal experience as a caregiver to someone with kidney disease. If medical advice is asked or given, the NCC will interject in the conversation. The treatment plan for each patient is unique to their personal needs and various factors, including other medical comorbidities. Always seek the advice of a doctor or other qualified health provider with any questions you may have regarding a medical condition. We want to let you know that the views and opinions expressed during this call are those of the panelists and do not necessarily reflect the official policy or position of the End-Stage Renal Disease National Coordinating Center or the Centers for Medicare and Medicaid Services. Any content provided by the panelists are their opinion and are not intended to substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider regarding a medical condition. Today's discussion is meant to be an informal way for caregivers of people with kidney disease to ask questions of other caregivers. We will be discussing the unique experiences of caregiver subject matter experts in caring for a loved one with kidney disease. We will talk about lifestyle adjustments and overcoming challenges, examine the role of family and care partner support. We'll talk about the role of family and caregiver partner support, and we'll review the differences of the caregiving role by treatment modality. This is the NPFE-LAN team, made up of Jerome Bailey, myself, Melissa Perry, and Kim Bittner. We work with a group of patients with end-stage renal disease and their caregivers to design and spread practical approaches that can be used to help other patients become engaged in their health and care to improve their quality of life. One of the goals of the LAN this year is to provide emotional well-being, to improve emotional well-being for people with kidney disease and their caregivers. The patient and caregiver subject matter experts on the LAN identified that person-to-person communication is the best way to provide emotional support to others going through a similar experience. We've selected a group of 4 subject matter experts from the LAN to answer your questions and share their individual experiences. First, we have Andrew Moncada from San Antonio, Texas. Andrew has 2 associate's degrees, one in horticulture and one in telecommunications. He owns his own lawn care and landscaping business. Andrew's wife of 7 years was diagnosed with kidney disease in 2017 and currently receives in-center hemodialysis treatment. Andrew is a kidney health coach and also serves as a patient advocate and is a member of ESRD Network 14's Patient Advisory Council. Welcome, Andrew. Yalonda Moore from Anchorage, Alaska, is a stay-at-home grandmother, bookkeeper, and a care partner for her husband, Gary. Gary went into kidney failure in 2012 and started on hemodialysis in-center. But after 3 months, Gary switched to peritoneal dialysis at home. Gary works as a rigger, making wire and rope cables. Yalonda and Gary have been married for 32 years and enjoy reading and spending time with their family. They have 7 children, 3 biological, 4 adopted, and 11 grandchildren. Welcome, Yalonda. Brenda Taylor from Chicago, Illinois, has worked in hospital administration for over 20 years. Brenda's husband started dialysis in 1982, only 1 year after they married. Her husband received in-center hemodialysis for 17 years before receiving a transplant, which lasted for 10 years. Brenda's daughter also has kidney disease and started dialysis at age 20 before receiving a transplant in 2015. In honor of her daughter and late husband, Brenda founded the ESRD Rockstars, a nonprofit organization which provides support to others caring for a loved one with kidney disease. Brenda also serves as a subject matter expert on ESRD Network 10's Patient Advisory Council. Welcome, Brenda.
Thank you.
And thank you. And Tina G. from North Chesterfield, Virginia, has a Bachelor of Science in Criminal Justice and a Master of Science in Public Administration. Tina works for the United States Marshal Services as a Detention Facilities Program Specialist in Washington, D.C. When not working, Tina enjoys volunteering and ministering in her community. She is a care partner to her husband, Patrick, a recent kidney transplant recipient. Tina also enjoys assisting her husband with an empowerment group at his former dialysis facility. Welcome, Tina. Operator, at this time, if you could please give instructions for how the participants can ask a question of the panelists.
Yes, ladies and gentlemen, if you wish to ask a question at this time, please signal by pressing *1 on your telephone keypad. Please ensure the mute function on your telephone is switched off to allow your signal to reach our equipment. Again, please press *1 to ask a question. There are no questions over the phone at this time. Apologies, we do have a question from Bridget.
Yes,
your line is open. Please go ahead.
Yes, I wanted to know, I am caring for someone who has been on hemodialysis since 2014, and I'm the only person who takes care of him, and he's also diabetic and blind. How in the world would I continue to care for someone like this without completely losing myself?
This is Brenda, and I'd like to just kind of elaborate on that a little bit. I too took care of my husband for many years and my daughter. Even though there was always a level of care involved with my husband, it was when they were both on dialysis for 5 years that I truly knew what it meant to take care of yourself and to make yourself a priority. And what happened was I had to really tap into my needs. I had to stop feeling guilty about taking time for myself. I had to find ways to have others come in and help, and know having help was okay, and to not feel guilty about that, and to just be very intentional on self-care.
This is Tina. I want to chime in on what Ms. Brenda said. Unless you are intentional about your self-care, you're going to burn out, and then you're not going to be any good to anybody because you're going to be frustrated, no one to talk to, and you'll be pulling your hair out. And then the person that you're being the care partner or caregiver to, they're not going to know what to do with you. They don't know if they've upset you or you're just going through or what. But just like Ms. Brenda says, you can't feel guilty. If you're not healthy, how can you care for somebody to help them be healthy?
Hi, this is Yalonda. One of the other things you need to think about is, even though as hard as it is, because my husband, when he first started out, Gary, my husband, he had a stroke, and so he didn't have his eyesight as well. This is a time that you know, as hard as it is, as much as you want to be there 24/7, lean on some of your friends, lean on your family. I mean, even if it's just that they come in and they sit for an hour or two, just so you can go get your nails done, go take a drive. But you always need to take a break and just have some me time. Because if you don't have any me time, you're gonna end up, because they go through a depression, they get cranky sometimes, but it'll make you cranky, and you're not going to be any help whatsoever. Like Brenda and them have said, you won't be any help to them. So you need to lean on your friends and family every now and then to say, look, can you just give me an hour or two? Can you come sit with them, or can you run them to a doctor's appointment or something, just so that you can have 5 minutes to yourself? You need to take a break. You can't do it all by yourself, and you've got to look at the fact that you have to take a break. You have to take time for yourself.
Thank you, ladies. Nope, sorry, I was going to ask if we had any more questions. Thank you.
We will now take our next question from Velda. Please go ahead.
Yes, I am caring for my mother, who was diagnosed almost 3 years ago. She's 91 years old. She has kidney disease. She's a diabetic, and I am an only child. She has in-center dialysis. My biggest challenge is her handling separation anxiety. That's the biggest thing. How do I, and she lives alone. Let me say that. She lives alone. So she basically gets her breakfast, and I come over, make sure she's done vital signs. I do housekeeping. I do financial. I do medical appointments. I do lunch and dinner. And she prefers for me to, when she becomes irritated, then she sends me home. Or if I become irritated, I send me home. So how do I handle the separation anxiety that she experiences?
Well, for me, I think that it's probably easier to just kind of reassure her that that I'm not sure. I guess it's a little difficult for me to know the level of care and the separation anxiety from what you just explained. It sounds like once you leave, because she's so used to you being there, it kind of presents a problem for her. But, even if it's just picking up the phone call or reassuring her that someone else would be there or you'll be back the next day, that's difficult. I think those are some things that could be helpful.
Okay, thank you. I call often.
We will now take our next question from Joy. Please go ahead.
Hello, everyone. Good afternoon. Can you hear me? Hello?
We can hear you.
Okay. I am a patient, and my question basically is all about asking the experiences of the panelists. What are the strategies that can be done by a ambulatory or a patient who's walking, not totally dependent, for a caregiver who's also mobile, totally dependent? In other words, I have read a lot about caregiver stress and caregiver burned out. And at some point, one of the dialysis nurses has mentioned to me, perhaps try what you call respite, meaning that because I do my home dialysis and my husband is my caregiver, I was advised to at least consider having a week or two occasionally in an in-center to relieve the stress from my husband. Have you done something like that, or some sort of a strategy similar to that to relieve the burden from the caregiver? Hello?
Hi, Joy. This is Yalonda. that goes back to the same, when you're saying relieving some of the stress and the respite, it goes back to the fact of leaning on your family and your friends. And there are places that you can also call to ask, for help, but at the same time, it's this with just like with me, when you get burned out, it's time to step away, because otherwise you're going to argue, you're going to fight. That's when you take your time, and for that week or so, if you need a week or whatever, that's when you say, okay, you know what? I need to put this in the hands of someone else. I need to step away. Let me go take a vacation, even if it's a staycation, and go check into a hotel room or something for a night or two, and it's, and even though you take that respite, don't get me wrong, you'll still worry about them. So what you do is you just make sure that your phone is always on. They can reach you if there's an emergency, but at the same time, you're not sitting right there with them, because then that way you get a chance to say, okay, let someone else fill in for a minute. Let me take a break. Go, and like I say, I've taken and I've gone and said, okay, well, I'll just take the week. I'll take 3-4 days and go to Vegas or something, or I have taken, and it's called go check into a hotel for a day or two, just so that you can get away, so that you can breathe, because you don't want to spend so much time together to where it becomes an agitation and more of an argument and things like that, because then you're no help to the other person. They're no help to you, because instead you guys trying to pull together to live, or to have the disease live with you, that you end up fighting and you end up tearing yourselves apart. And you don't want to tear yourselves apart because you just can't, because you're too scared to take a break. You have to take a break. Just, for the rest of it, call someone and have them come in and fill in for you.
I believe, I apologize, I believe I didn't express myself correctly. I am the patient, and I am asking what strategy would be best for my husband, because I feel that, I don't know how to express it, but I feel like I'm demanding his time.
That would be just like my husband, what he does, when he sees that I'm getting frustrated, and stuff, he looks at me and goes, you know what, it's time for you to take a break. So you as the patient, if you see that your husband's getting frustrated, you feel that you can handle, being at home by yourself, or you can find someone to come and say, you know what, I appreciate everything that you're doing. I'm happy that you've been here with me. I'm happy that you're here to support me, but I think you need a break. You know what? Why don't you go fishing? Go hang out with your friends, go to a movie. And what you do is tell them how much you appreciate, tell him how much you appreciate him, and then tell him, but why don't you go take some time to yourself? You spend all your time with me, go take some time to yourself. It shows them it shows him that it's okay for him to step away for a minute, because he could be thinking that, because I did it. If I felt that if I stepped away for 5 minutes, he'd think I was putting him down. He'd think that I wasn't there for him, or he didn't have that support. But when he saw that I was getting frustrated, he said, you know what? Why don't you go get your nails done? Why don't you go hang out with your mom or your friends for a little while? So by telling him that it's okay to leave me for a couple hours or a day or two, I will be fine. Then he'll go, because what it is he could be thinking in his head that he's scared that if he asks you, is it okay for me to go, you might feel like he's putting you down. You need to let him know that you won't feel like that him taking a break is not thinking about you. So just let him know that it's okay and that you understand that he needs a break.
All right. Thank you so much.
And I would also I'm sorry. I would also
go ahead.
To add that, in my opinion, that really does kind of go back to, I believe, separation anxiety, because when you care for a patient, you feel like sometimes you learn that patient to the point where somehow, whether it's true or not, you feel, well, I did, felt like I was their lifeline. And so sometimes I would be so tired because I held a full-time job as well. I would be so tired that it was difficult for me as much as I knew that I needed to take a break. And so what I had to do was I had to start in small increments, leaving my family. At first I started with just kind of going in another room for about an hour or so. And then I made it a habit to just go to the lake for 1 hour after work. And I noticed after I did that, when I came home, my mindset would be totally different. Eventually, I got to a place where I was able to take longer rest periods. So maybe starting out and taking small breaks could be helpful as well.
I would like to add, if I don't know where you live and I don't know what state you're in, but I know in some states there are support groups for those who are caregivers and care partners. See if there's something like that in your state that he can, have a release to talk to somebody about. Maybe he is not yet comfortable telling you, hey, I really need a break, but I don't want to leave you here by yourself. Just keep reassuring him, just like everyone's saying, reassure him it's okay. You need time just like I need time. And even though you're the patient and you want your husband as your caregiver or care partner to have that time, you need to let him know, hey, we both need time away, even if it's just like she said, going in another room.
Thank you, everyone.
We will now take our next question from Gail. Please go ahead.
What if you are caring someone who is on dialysis and they are have dementia, and you struggle with limiting the amount of liquid that they drink in a day, and they don't want to necessarily follow all of the restrictions? What would you suggest? Because the person is an adult. You can't treat them the way you would a child. So, what are your? Does anyone have any suggestions for that?
I can't speak on having somebody with a chronic disease and having dementia. Those two things are inseparable, two different items to handle at the same time. That's a tough one.
I would say the same thing. I don't have any expertise in that field, but I would probably reach out to someone who does to figure out a good strategy for handling that.
Okay, thanks.
Maybe.
Oh, go ahead.
Maybe you can check with the hospital or some of the staff, or like she said, reach out to some of them, and maybe they can guide you in a better direction. Because those are two different animals you have to handle. And sounds like you got your hands full, I hate to say, but bless you. Bless you, bless you, bless you.
Dementia is a hard one to deal with. I can't even help you with that one. I have a friend that has a mom that's dealing with dementia, and I pray for her every day. So I can't even answer that question. I'm sorry. I wish you the best of luck. Like they say, there's a lot of Alzheimer's sites. I have seen that, just like we have our sites, our ESRD sites. I pull up some of the dementia, the Alzheimer's sites, and see if they have some recommendations, because I'm sorry, that one I can't answer.
There are no further questions over the phone at this time.
Okay, we have a message. For the last caller that had a question, I want to add that you should talk with the dialysis social worker regarding options for resources in your community to help manage the dementia. As far as the fluid management, I would reach out to the dietitian at the facility and let the dietitian know the difficulty that you're having, and you can work together to try to come up with, with a care plan. Aside from that, we do have a question in the chat box. How do you balance being an advocate for the patient without taking away their autonomy or their ability to make their own decisions?
For me, communication. When I was dealing, when Patrick was on dialysis, having to dialyze so many times a day, it was very hard for me to get him to understand I'm just trying to help as a caregiver. I don't have the disease, and I really didn't quite understand other than going to the trainings they offered us and little educational pamphlets they gave us on what he was going through. So I had to learn to communicate better. I thought he could read my mind, which I knew that was impossible, but communication is the key. Don't assume anything. Ask questions. And when you ask questions, don't ask it in a manner to where they may be feeling like you're treating them like a child. Ask questions in a manner to where you're in a loving and caring way. To just say, hey, for instance, when he was dialyzing at home, on home dialysis, I would see him sitting in a chair, and to me, he appeared like he was depressed. I just assumed it. I said, okay, so he's having a depressed day. I'm not going to talk to him. Well, that was not the answer, and that was not even far from what was really going on. He was in pain. I didn't know it. I was like, Patrick, are you depressed today? He said, well, what would give you that? What would even make you ask that question? I said, the appearance, your perception. The perception was you appear to look like you're in going through depression. He says, no, all you had to do is ask. I'm in pain. If you had asked, I would have told you what was going on. So never assume, just ask the question.
I agree with that. Okay. I agree with that. Communication is key. And one of the other things is it's also important that you empower the patient with information that will assure them that you're there to support them in their health care journey. But we also have to encourage them to speak up. And there are various strategies for doing that. The thing is, we have to remember that the professionals and the caregivers know about the patients and kidney disease, but nobody knows their body like the patient knows their body. And so they can give you information, and they have to know that they have to feel empowered to give you that information and tell you how they feel, so that you'll know how to handle what's going on, as well as listening. Listening is a key factor as well.
Another way to let them know that they are in control of the situation, just like when we started, every time my husband went to the doctor, I just assumed that I needed to answer all the questions. I needed to, every time the doctor or someone asked him something, I'd answer. And I got to the point to where I had to realize, you know what, when the doctors or the nurses ask a question, let them answer. Before you start in automatically or something like that, take a breather, and wait and see if they're going to answer the question. And so I had to start sitting back and letting him try first to answer the question and wait until they turn around and say, you know what, I don't know the answer. Can you ask my care partner, my wife, my husband, or whatever, and give them, before you jump to do it for them, give them a chance to do it themselves. So then that way it shows that they are still in control of their life and they can still take care of things themselves. And wait until they, other than the things that they want you to do ahead of time, but otherwise, give them a chance first. Let them be the one to initiate something. Let them be the one to try and answer the question, and wait until they give you that signal that says, "Hey, I need some help here. I don't know the answer, or I can't do it, or So then that way they start off in control, and it's not that you're controlling the situation for them. Let them control it first by giving them a chance to do what needs to be done before you step in and take over.
Thank you, ladies. Operator, do we have any other questions on the line?
Yes, we have a question from Connie. Please go ahead.
Yes. How do you handle a patient having muscle cramps? Because I'm a patient and I have muscle cramps.
Well, as a caregiver, what worked for me, because that did happen frequently, we would just first of all we would alert the team at their center, their professionals, letting them know that they're experiencing muscle cramps, and then they would provide information on what we needed to do when that happened, and then I would just follow through on the advice that they gave us. A lot of times, it's different from various partners for various patients, but that is pretty frequent for kidney patients, and usually their professional team can guide you through that process.
Thank you.
We have another question from Zelda. Please go ahead.
Yes. How do I receive training on how much fluid to take off when we get to the center? Sometimes patient will say, we'll take off this amount or that amount. I've never received any training for that.
This is Melissa with the NCC. I'm going to jump in and say that you should seek guidance from the nurse or the renal dietitian at the dialysis facility. Should be able to provide you with training on that. There is also a resource on Home Dialysis Central. It's called it's a fluid calculator, and if you put in certain information, it'll help you or the patient determine a safe amount of fluid to pull off during treatment. But definitely first get with your healthcare team.
Thank you.
Even as a caregiver, get with your loved one's healthcare team. You as a caregiver are part of the team as well.
All right. That helps. Thank you.
Jane, may I add a few things?
Please do.
Hi, my name is Jane Wilson. I'm a nurse and a dietitian. If you're new to the hemodialysis, what I would do if I were a caregiver is bring a notebook to dialysis and track down the patient you're caring for, their weight before dialysis starts and after dialysis starts, and start tracking their weights. And you'll get a good idea of their weight gains and weight removal each day that they go to dialysis. And then you want to compare that.
I do have that.
To
great.
And you'll want to compare that to the weight that the doctor establishes as the dry weight or estimated target weight.
Okay.
And
They
then
do
that'll
have a
give you an
patient
idea.
portal, and I refer to the patient portal all the time. Okay, good.
So that should help with trending and kind of expecting how much fluid should be removed to reach that target weight. And then also knowing how much the person is eating. If their appetite has increased, they might be gaining body weight, or if they've been having diarrhea or not taking in as much food, you might anticipate that the weight set for that treatment will be less.
Yes, exactly. Thank you.
There are no further questions over the phone at this time, but once again, it is *1.
Thank you, Mary. We do have another question in the chat box. Is there a type of treatment that has been easiest for you as the caregiver for your loved one to be on?
For me, we kind of discussed that when we learned that he had kidney failure. We really didn't know what kind of treatment was out there. We learned that there was many modalities that you could use. The information that we got from his center and his doctors, we took that information and we kind of looked at it based on our living, how I go to work basically, because I travel a lot. We needed something to, his care needs to be a little easier for him when I wasn't there. And we didn't have the option of having somebody come in the house and ensure that he was doing what he was doing. I needed to be assured that he could take care of himself. So the modality we chose was home PD. And for us, it worked out very well. When I was traveling and he was in good spirits, he would travel with me. So just because we did home PD, it wasn't a death sentence to where he didn't, get a chance to get out or see the world, as they say. Anywhere he wanted to go, we just had to plan it out with our care team and let them know we were going at least 30 days in advance so they could prep us and make sure there was people on the other end of where we were going and that was doctors on the other end or centers where he could go, because we did PD at home.
For us, it was the easiest. Us choosing home PD. I had a husband that was control freak. He couldn't stand anyone else being in. He hated having to go to the clinic and being dictated to that, having to be stuck in the chair for 4 hours and not being able to get up and move and do anything. And so he needed to do something where he had more control himself. And so for him, being at home and doing home PD was better for him because he was able to control it himself. He had more. It wasn't about someone dictating his time and when he had to do it and what time he had to be there. So looking at trying to figure out which one is best for you, it just depends on your lifestyle and what you can deal with. If you want to be able to go to the clinic and sit back, relax for a few hours, or whether it's that you want to be at home and be able to control the situation yourself as to when and what time you do the dialysis yourself. So it just depends on your lifestyle and what it is that you want to do.
I do want to say, whatever modality you choose, don't assume that modality will limit you. Just like she said, you just got to pick the one that works best for your lifestyle.
Operator, do we have any other questions on the phone line?
Yes, we do have a question from Swami. Please go ahead.
Yeah, I think people are talking about different modalities. There is a modality called nocturnal dialysis, in which a patient spends overnight going through dialysis. Some centers and that may be another opportunity for the caregivers to rest while the patient is undergoing dialysis at the dialysis center. I don't know whether any one of you tried that.
Thank you, Swami.
Okay.
Mary, do we have any other questions? Okay.
There are no further questions. So once again, as a reminder, to star 1.
Okay, we'll go back to the chat box. Yalonda, you touched on this a little bit, but since it's there, I'll put it out there. Are you able to travel, and how is that? Easy is it? How is that process?
Travel. My husband and I, we travel quite a bit because we have children that aren't here with us. We just a couple years ago, a group of us decided to take a cruise. And for the longest, my husband's like, well, I can't go because, there's special cruise, got to have a special cruise, this, that, and the other. But actually, we ended up traveling to the Bahamas. And we found that once you contact your facility, contact the cruise line, and they'll communicate with each other about how long the cruise is. And since your dialysis facility and everyone, they know the prescription. They'll correspond with the cruise line to make sure that the cruise line gets the supplies, and they made sure that we didn't have to do. Once we told them what time we were going, how long we were going to be gone, they took care of everything pretty much themselves. They took it and they made sure the cruise line had the stuff, and they put it in the room, and it was really smooth. It's not hard at all to travel. The biggest thing that we found, I have heard that there's some patients that have been able to do cyclers on ships. However, with us, we found that they say that some of the cyclers won't bounce out on the cruises, so it's easier to do manuals. And for him, actually doing a manual and doing it manual through the 7-day cruise, because we did a 7-day cruise to the Bahamas, it ended up being great because he was able to take and he wasn't stuck, being hooked up to a machine for 9-10 hours or whatever it took. He went in, he'd do it, in the middle of something or in between our different activities. He'd go in, do a quick exchange, come back down, and do what he needed to do. So a lot of people think that you can't travel just because you're either on home dialysis or doing hemo, but it's easy. And then some of the ships actually have. We have found that some of the ships actually have a place where you can do them on the ship. Do if you're doing an in-center. So you just have to take the time to find out where you're going and what facilities are there. Make sure that and for the most part, getting in touch with your supply place. They request that you give them at least 45 days notice so that they can make sure that they have all your equipment and everything they need to go where you're, to have it sent to where you're going. So traveling is actually very easy, and so don't sit around saying, okay, I can't go nowhere, because you can. There's no place you can't go. And if the biggest thing we've had is that a lot of times when you're flying, unfortunately, they don't take care of the machines as well, even though with us we have the machine marked fragile, medical equipment, everything, and they don't. They don't really take care of the machines that well. But we have found that with the facilities, you get on the other end and there's something wrong with your machine, normally within 24, and that's the way it's been, at least for us, normally within 24 hours, they can have you, and they can send a new machine to wherever you're at. So So it's real easy. So I don't, where I used to stress about traveling, I don't anymore, because it's, you know, between the facility and everyone, they seem to have it all planned out, and they've contracted with different places to have supplies done, so you don't have to worry about that. It's really easy.
For us, it was really, we didn't do a cruise like she did, but we ended up in San Diego for 2 weeks. And my biggest worry was housekeeping, because you need to have a clean, sterile room and everything needs to be clean. But once we kind of explained, you know, what we needed and how often we needed it, just like she said, it all worked out. It took him a little time to get comfortable knowing that, you know, we had to make all these pre-preparations in order to go anywhere. But once we started, nothing stopped it.
And for my husband and daughter, they both did, the modality that they chose was Zen Center, and they were both able to do a lot of traveling with Zen Center dialysis. It takes a lot of planning and organizing on the part of the patient to make sure that you touch base with your dialysis center and have them arrange treatments wherever you're going. And then once that's done, we would they would arrange their activities on the days that they're going to treatment. They would make sure that their activities are a little lighter, because once you're done with treatment, of course, sometimes you're kind of tired, and you just kind of schedule your activities around your treatments. But it worked out fine for them as well.
Mary, do we have any other questions on the line?
There are no questions over the phone.
Okay, and we have no questions at the chat box, so at this time I think that we will start to wrap up. I want to thank everyone for being on the call today. There have been some very thought-provoking questions asked of our panelists, and I hope that all of your questions and concerns have been answered. I also want to thank the panelists for being with us today, and we appreciate you sharing your experiences. Here are some additional resources on caregiving. The ESRD NCC, which is at www.ESRDNCC.org/NPFE-LAN. The American Association of Retired Persons, also known as AARP, has a family caregiving resources, and those can be found at www.aarp.org/caregiving. The Caregiver Action Network is located at www.caregiveraction.org. The ESRD Rockstars are located at www.esrdrockstars.com. The Family Caregiver Alliance can be located at www.caregiver.org. And the National PACE Association can be located at www.npaonline.org. If you have any questions for the NPFE-LAN or the ESRD NCC, the email address is nccinfo@hsag.com, or you can call 844-472-4250. The NPFE-LAN team address is 3000 Bayport Drive, Suite 300, and we are located in Tampa, Florida at 33607. We would like to end today's call with an inspirational quote from Bethany Hamilton. Courage doesn't mean you don't get afraid. Courage means you don't let fear stop you. Thank you, everyone, and goodbye.